Do you see my screen? Hello?
Yeah, good morning.
Yeah. Good morning, everyone. Okay. Let's go back here. Can you tell me if you can hear me well or not?
We can hear you well.
Okay. You see my screen?
Yeah.
Great. So today we're going to talk about causes or etiology of disease. And I think or believe that this is an important topic as a medical student and as a researcher as well in biomedical field. Okay. So as we alluded to before, the definition of disease is a specific pathological process with an etiology. Etiology is mainly the cause or what initiates the disease. And it is characterized by signs and symptoms and has an outcome. All right. So what's the definition of a cause? This is, as we said, the definition of disease is the pathological process which has a cause. And now what's the cause? The cause is an event or condition without which the disease would not occur, right? Is the cause different from risk factor? Yes. Like people born in Europe or North America, more susceptible for some diseases, like heart disease and some cancers. And this is the risk factor, not a cause. Then if you're being like born in Asia or Africa, you will have less risk factors for this disease, but still, this is not the cause. There are some criteria for causality. So to establish causality like this causes this, you should have like the cause must occur before the effect. The cause starts and then the effects appear. And there should be covariation of cause and effect, means they occur when the cause present, the effect will be there. When the cause is absent, the effect shouldn't be there. So this is also important in your research. The relation shouldn't be like spurious, means false or fake, which it shouldn't be influenced by confounding variables, like a confounding effect. And there should be theoretical justification, like a logical rationale from the literature support that connection, as well as there should be the most important point, there should be experimental evidence through the controlled randomized studies, which offer like strong support for the causality. So these criteria are important for researchers to identify the causal relationships between anything, including mostly diseases. Okay. Now let's talk about what initiates disease. What factors can lead to development of diseases? Can anybody tell me? What do you think can cause disease? That simple thing for medical students. Come on.
Bacteria.
Yeah, infection. What else?
Genetics.
Genes, genetics,
Virus,
inherited fact. Yes, Tony?
viruses, fungi.
Viruses. All right, same line. That's good. So those are the things mostly can initiate disease. And this journey was like really lengthy in the 19th century to reach to the conclusion what causes disease. You imagine like around 150 years ago, people were thinking that tooth eruptions or teeth eruption in children and menstruation causes problems and diseases. There was theories about that, like the bad air theory and or bad environment theory, and the other theory was just like imbalance between body fluids, blood, phlegm, and menstruation, and so on. What comes out and what goes in the body causes diseases. So this is a simple thing, but now with the research, we reach to the point that we analyze the whole human genome and find out what causes the diseases in the genetic level. So to summarize causes of disease or etiology of disease, either internal factors or intrinsic, external or extrinsic factors, and we still have some idiopathic factors which are unknown. We don't know. Some diseases, we don't know what caused them. Okay. So, as you all said, intrinsic or internal, like the genetic makeup, the metabolism, related to the endocrine as well, or endocrine, immune factors, neoplasia or tumors. Those are all internal or intrinsic factors or internal causes. Extrinsic factors or external causes, as you all mentioned, bacteria, viruses, infectious, trauma, either physical or chemical, and by you guys, heterogenic, as we will talk about, as well as the idiopathic factors. So if we start to think about internal or intrinsic causes, what causes diseases from the genetic point of view? Either monogenetic, which is rare, like all of you studied the Mendelian genetics, and those are really rare now. So if there is a dominant gene mutation, like in Huntington disease, or recessive gene mutation, like in Friedreich's ataxia or cystic fibrosis, this results in disease. The most common is multifactorial. And actually, the multifactorial is probably the genetic part of multifactorial disorders is very important and present in every another disease, almost. So they are high incidence, more common, and we all see heart diseases, obesity, diabetes, cancers, Alzheimer's disease, dementia, and other mental disorders. This is on gene level. Sometimes on chromosomal level, you have disorders caused by extra chromosome like the trisomy. All of us know the trisomy 21 or Downs, or missing chromosome and Turner syndrome, which is like Turner patients miss one chromosome, one X chromosome. So they have basically 45 plus X rather than XX. or translocation of part of that chromosome on another one, like in chronic myeloid leukemia. Very obvious example of chromosome 9 and 22 translocation. The metabolic causes, as we know also, metabolisms like either catabolism, you destroy the nutrients or break down the nutrients and get energy, or anabolism, which is you build up new material using energy released by catabolism. The metabolic disorders, the very famous common metabolic disorders like diabetes mellitus, this carbohydrate metabolism disorder. We all know types of diabetes, type 1, type 2, and type 2 is mainly due to insulin resistance or insulin insensitivity. So it's the carbohydrate metabolism. We all know that it needs the insulin, and insulin released by the pancreas, which is like endocrine glands, so the beta cells. So the endocrine system regulates the metabolism, obviously. Even thyroid and adrenals are involved in a lot of diseases. Other examples of metabolic disorders include lipid metabolism disorders, like lipid storage diseases, Niemann-Pick and Gaucher's disease, Tay-Sachs, and all of that stuff. And protein or amino acid metabolism disorders, like phenylketonuria or ketoacidosis, and mitochondrial diseases. We know mitochondrial myopathies. Among the four omics you probably heard about from Dr. Rai, the genomics, transcriptomics, and proteomics, metabolomics. I think the metabolomics is the most important because it reflects actually the molecular phenotype, which indicate the immediate environment of tissues and cells. Other internal causes like immune or immune system problems that cause disease, either hypoactivity of the immunity, hyperactivity, or even the body fights itself, and autoimmune diseases. And you know the hypoactivity or immunodeficiency disorders, the SCID, which is the very obvious or common in your box, which lacks B and T lymphocytes, like the bubble boy. There's IgA deficiency, thymic dysplasia, and chronic granulomatous diseases are other causes of disorder or other examples of immune system disorders. We know the secondary immunodeficiency disorders, the very famous AIDS, or we know it all. Chemotherapeutics can cause immunosuppression. Burn can cause immunosuppression. Malnutrition can cause secondary immune disorders, as well as hyperactivity of the immune system, like allergic reactions. We know the hives and allergies, seasonal allergies, anaphylaxis, eczema, asthma, all are hyperactivity or hyperreactivity of the immune system. The autoimmune diseases, the body forms antibodies against its own normal tissues, like in lupus erythematosus, in scleroderma, in dermatomyositis, in juvenile idiopathic arthritis. All of that are examples of autoimmune disorders. Neoplasia is very common, like abnormal growth. This is internal. This is not like, it might be excited now by or predisposed by external factors, but the main pathology is internal, like forming a benign tumor like lipoma, fibroma, and all of that stuff. And we know the difference between benign and malignant. The malignant tumor is called cancer mainly, and it invades tissues. That's why it's cancer. So, but the benign doesn't invade the adjacent tissues or structures. The benign tumor does not spread, but they have problems. Sometimes benign tumor in the brain has like very catastrophic effects, like increased intracranial tension and neurological symptoms and so on. So although it's benign, but it can be drastic in the effects on patients. All right. External or extrinsic causes, as you all mentioned, the infectious, very obvious external cause, diseases like bacteria, viruses, protozoal and fungal diseases. The external causes also include traumatic trauma, which may be physical or chemical. And we know the physical trauma, like the road traffic accidents, like if you go do angioplasty, you can just trauma to the artery that causes some problems, heat trauma in this hot weather, burns, radiation, and radiation mainly affects the DNA repair. Chemical trauma, like the acidity or hyperacidity and reflux disease, which affects the esophagus and leads to the Barrett's esophagus, or smoking, which affects the bronchial epithelium and causes bronchial squamous metaplasia, bronchogenic carcinoma in the long run. As we said, also iatrogenic, which is like created by the doctors, like doing diagnostic or therapeutic procedures, like an X-ray radiation or exposure, injection of contrast media, drug effects, transfusion effect, intervention, and surgical interventions as well. Like minimally invasive things like angioplasty and all of that things can rupture a vessel or so causes a problem, which is, we call it iatrogenic disease now. So if you remember from before what's pathogenesis, so the pathogenesis was the development of disease. So you have the normal human body organs, tissues, and cells, and they become abnormal due to the etiological factors we just talked about, either internal or external. And as we explained before, that how the disease happens or develops, these etiological factors affect the normal tissues because cell response or tissue response, like inflammation, and the tissue will respond by inflammation and then try to repair the inflammation. So repair may cause fibrosis, and this will end up with abnormal or diseased organs or tissues at the end. Same the response of cells. We talked about intracellular substance accumulation, as we talked about the fat storage diseases. And cell adaptation, we talk about hyperplasia, dysplasia, and metaplasia. And we talk about formation of cancer. Cell response can lead to cell injury and death if the injury is beyond the capacity of the cell to bounce and recover. So you have cell death. And cell death is either apoptosis or necrosis. Necrosis is the most important pathological problem here and can cause inflammation and so on. So all of this pathogenesis leads to abnormal tissues and diseases in the organs and tissues. End up with the disease here. Okay. So it's like interaction between etiology, pathogenesis, and all of that stuff. So can you remember from what we talked, like 5 causes of disease? Can everybody tell me like a cause of disease from what we explained? Kirsten? Okay. Tony? She's on.
For causes, I'll say that you mentioned internal and external factors. Internal factors included genetics,
Great.
and some external factors included the infections like viruses, bacteria, and then iatrogenic factors as well.
Great.
And I think there were idiopathic factors as well that were kind of unknown.
Right.
Yeah, you
Okay.
also talked about smoking cigarettes.
Yeah. And how smoking is like causing change in the cell,
Mhm.
the bronchi, from columnar ciliated epithelium to squamous epithelium. And this is like the basis of metaplasia, and then it may proceed to dysplasia and then cancer. So, like, this is a trauma, like cigarette smoking is trauma, chemical trauma to the epithelium. Yeah. What else? From what we talked, the immune causes immunity problems, like immunity hyperactivity, immunity hypoactivity, like the AIDS, acquired immune deficiency syndrome, like the SCID, the bubble boy, and all of that stuff. Hyperactivity or hyperreactivity, like asthma, like eczema, and all of that things, and autoimmune diseases like systemic lupus, rheumatoid arthritis, and all of that diseases. So those are the most common causes of disease. Any other suggestions? Right. If no, then what do you think what's the pathophysiology of disease? Can you define what's pathophysiology? Disease, in your opinion?
I'll say is the molecular mechanism by which something causes a disease in the body.
Great. So patho is the pathogenesis we talked about. Physiology is the function. So the pathophysiology, like research in pathophysiology, looks at, let's bring it here. It looks at, like, if you examine the molecular mechanisms of how these etiological factors and how the pathogenesis happen. This is the pathophysiology. And if there are some biological markers that can predict the disease and its etiology, this is very important. And in medicine, you always talk about pathophysiology because it's how the pathogenesis and etiological factors alter the function of that organism on cellular, molecular, and even systemic level of the patient. So you talk about how etiology and pathogenesis alter the function and how you predict or identify the biological markers and molecular markers caused by the disease. All right. Any questions? We still have time. It's only half an hour. No questions? All right. Then we can just end this. We'll talk about next time, we'll talk about pulmonary diseases. So when you have a disease, you should talk like about probably what are the causative factors in that disease, as we said, internal, external, idiopathic, and how this factor promote or produce the pathogenesis of that disease. So we'll talk about the pathogenesis of the disease. And the pathophysiology of that disease means how this disease affects the function of the respiratory system, like how this disease affects the gas exchange. Breathing mainly is just to get the oxygen in and CO2 out. And then we'll talk about the pulmonary function tests, how to test the effect of this disease on the function of the organism or the patient. And we'll talk about a little bit about the cellular and molecular levels of those changes, as well as the systemic effect. All right, so this gives you a scheme when you talk about any disease. I think, did you start studying pathophysiology or it's next year?
It's more next year for us DO students.
Okay. So this year you studied physiology and the normal anatomy and physiology, right?
Yeah.
And some CMR, like how to take history and examination, all of that stuff.
And anatomy.
Plus the OMM, of course. All right. If you have questions, we can talk about them. If no, we can adjourn. Any questions? All right. No questions. Okay. Thank you for attending, and we'll see you next time.
Thank you.
Thank you. Bye.
Thank you.